Hello, everyone. My name is Francesca Merico. I work with UNAIDS and PEPFAR as technical support for the faith engagement. And I had the honor to be part of the planning team for this conference. Thank you for being with us at this very final session of the HIV Interfaith Conference, Resilience and Renewal, Faith in the HIV Response. I feel so privileged to have had the honor to hear all the many inspiring people sharing their journey, to have learned from the speakers, the models and the best practices shared, and to have tried to capture your recommendations and suggestions during these several sessions of the very rich conference. The first thing I want to do is to acknowledge the amazing people who have been working together for several months to put the HIV Interfaith Conference together. We have Dave, George, Julien, Manoj, Stuart, Subi, Hawa, John, Nkata, Khadija, Brian, Ulysses, Jacek, Mike, Lynn, Rick, and Stefano. Thank you to each one of you for your dedication. We really hope that many more will join forces with us for the way forward and the follow-up to this conference. So please be and remain connected with us. Et pour les francophones, on espère vraiment de pouvoir inclure des orateurs de langue française dans les prochaines activités. Donc, on compte vraiment sur vous et sur votre collaboration pour rendre ça possible. The way forward. A key message I want to share with you is that for us, this conference is not just an event, but it's a way to build stronger and better coordinated collaboration and partnership among different faith groups, as well as between faith and non-faith actors in the HIV response. The conference is a step into a broader engagement with all of you. So we would like to propose some follow-up actions, which are shaped from what we have heard during these days and from your recommendation. What are the actions of resilience and renewal that together we could bring forward? During these days, the facilitators have been inviting all of us and the speakers to offer recommendation around key 4 areas where we feel that the contribution of the faith response is very much needed and where we feel that we could do more and better. The first area is what faith leaders, individual and faith communities could do to increase access to services. How we can better promote human rights and better understand them. How we could contribute to eliminate stigma and discrimination. And what we should do more and better to build bridges of collaboration among different faith groups and among faith and non-faith groups for a better and more effective HIV response. The first action we are proposing here is a joint activity, is a joint advocacy activity. So as concrete follow-up from the HIV Interfaith Conference, we want to engage with all of you in advocacy. And we want to further engage with faith leaders and community around the world. So we are taking the opportunity of the HIV Interfaith Conference to launch the 13 Million campaign, a campaign to promote access to treatment, retention, and viral load suppression to the 13 million children, women, and men living with HIV who are not yet on treatment. Yesterday, we have heard that worldwide, 38 million people are living with HIV. 25 million among them have access to treatment, which is an incredible progress from the past. But at the same time, this means that 13 million people are still waiting. And we have heard that 1.8 million children are living with HIV, but only half of them has access to life-saving antiretrovirals. Who are these children, women, and men? And the 30 million campaign calls on each one of us to join forces to ensure access to services, care, and support to each person living with HIV. The campaign identifies so far some actions which I want to share with you. First of all, support the identification of and collaborate with faith and spiritual HIV champions in each of our countries and a global level. The 13 million campaign will involve at least 13 faith leaders in each of the world's countries to be strong and coordinated voices for the rights and dignity of all. Secondly, we want to mobilize action, starting from our places of worship and our communities, to ensure that the 30 million children, women and men who are living with HIV and are not yet on optimal life-saving antiretrovirals have access to HIV treatment, remain on treatment, and have their viral load suppressed. Thirdly, we are asking each one of you and many more to endorse the campaign by signing our promise to action and by encouraging members of your faith community, of my faith community, to sign it and support it. Our promise to action is a sort of outcome document of this conference, which captures the highlights, the key findings and actions suggested by the speakers, by the faith leaders, and by the participants. So the second important piece of follow-up to this conference is our promise to action document. We have just heard the reports from the many sessions of the conference, and I am really amazed and energized by all the ideas and information that have been shared. Resilience and faith are the drivers of our response to HIV. But we feel that it is also very important to renew our promise to act together to end AIDS. So resilience and renewal go together, hand in hand. Our promise to action is a sort of call to action, which we are asking you all to sign as a symbolic gesture of our renewed commitment to work together to end AIDS. And then finally, the third important piece that we want to work on together with you all. It's the Interfaith Health Platform. To keep connection among faith groups and individuals, to highlight the work and the incredible work of many of you, of the faith leaders, of communities on HIV, to collect best practices and evidence-based models of faith engagement on HIV, to work on joint advocacy for a better HIV response, but also very importantly to track progress towards the commitments and action of our promise to action document and of the 13 million campaign. We are launching here today with you an online interfaith health platform. The platform is a multi-religious collaborative space for capacity building, awareness raising, and joint advocacy among faith groups, among individuals, organizations, and communities engaged in HIV, but also on related diseases such as tuberculosis and COVID-19. Aquarius, our facilitator, has been repeating several times during these days, nothing can replace face-to-face in-person connectivity and sharing. But also we need to make sure that we leverage on and better capture the amazing work done by so many among you, learn from each other, and then act together in a coordinated way. I want to repeat once again that the platform will be used to track progress towards the commitments made. And so we will be knocking at your doors to make sure that each action we have committed to will be truly implemented. Here is the link to the health platform. And so by clicking on advocacy or advocacy opportunities, you have a section for joint advocacy. And here you will find information about the 13 million campaign and our promise to action document, which again, we are asking each one of you to sign and to renew your commitment to work on HIV together with others. Then the website has also information related to the HIV Interfaith conference. So if you click on events, you're gonna already go and see a lot of information about this amazing conference. And here you will be able to access the presentation and the recordings of this conference. And then we want to add another important piece as a follow-up, a webinar series. And from mid-November 2020, we will be starting a series of webinars to go deeper into some of the issues discussed during these days. You will receive information about the webinars via email, so please remain in contact with us. But also, in that occasion, on va vraiment essayer de faire en façon que les participants des langues francophones vont pouvoir partager leur expérience et leur importante contribution à la réponse contre le sida. So now I want to thank you, everyone. But before closing here, I like to thank really all those who made this conference possible. The planning team, UNAIDS and PEPFAR for recognizing the important role of contribution of faith in the HIV response. I want to thank each one of the speakers, the faith leaders, the children, the young people, the facilitators, and the interpreters. I want to thank those who are behind the scene and offer technical support. And I also want to thank my special angel who has helped me with editing all the videos for this conference. I really appreciate each one of you. And so now we are gonna invite my colleagues to read our promise to action together with you, and then invite you all to discuss and feedback on the way forward. Thank you.